Well, a lot of the female patients I see with voiding dysfunction, the goal is to really, number one, ascertain as to what the cause of their voiding dysfunction is. And that can revolve around stress incontinence, where they'll leak with heavy lifting, coughing, sneezing, running, those kind of symptoms. Or it'll be something more on the other spectrum, which is urgency frequency. They'll have many accidents at night. They'll get the urge to urinate, can't make it to the bathroom quick enough before they have an accident. Evaluation in the office for patients with voiding dysfunction often centers around urodynamics. If they fail medications, it's a procedure that measures the pressure flow within the bladder, basically the functionality of the bladder. We'll do a thorough pelvic exam. We'll do a full history and physical, make sure they've done everything conservatively to manage their voiding dysfunction first. And then oftentimes we'll perform a cystoscopy, which is a look inside the bladder. Then we go to a treatment. Oftentimes we'll start conservatively with medications or with physical therapy, do things like decreasing your fluid intake, making sure the patient understands that a lot of it is on them upon trying to improve their symptoms with a change in their overall lifestyle. And so that's always the first priority. Something more involved in regards to treatment. If you're talking about stress incontinence, oftentimes we'll talk about three main approaches. If Kegels do not work, then we'll move on to two main options for stress incontinence management. Would be bulking, where actually inject a medication into the urethra or around the urethra to bulk up the urethra. The other option, which is commonly done, is a sling, which is a small piece of mesh that sits behind the urethra, prevents mobility of the urethra. When we have patients with urge incontinence, when they fail medications oftentimes, there's really kind of three main options we have at that point for interventions. One of these is Botox that just recently got FDA approval about a year ago in regards to overactive bladder management. So we can actually inject Botox into the bladder wall. Second one would be peripheral nerve stimulating, where we actually stimulate a nerve in the foot to send signals to the spinal cord to tell the bladder to calm down. It's an office treatment. And then a little bit more involved is a procedure called interstim therapy, which is basically like a bladder pacemaker. It's a small wire we place on the sacral nerve root, and the patient has a sensation of a tapping sensation within the bladder area, rectal area, and it tells the bladder to calm down. The success rates of those procedures are more along the lines of over 75%.